everyone. Thank you for your patience as I always somehow manage to have trouble sharing my screen. This is what tells you that I am a millennial and not Gen Z, who I feel like grew up knowing how to share screens. Great. So today we have finally, oh, it says lesson 4. This should be lesson 5. We have finally arrived at lesson 5 of the series Medical English online classes. My name is Ariella Knight. I am the founder and CEO of the American Institute here in Algiers. And this is a program that we are doing in partnership with the U.S. Embassy Algiers, where I am offering a series, actually 5 series in total, of courses specifically focusing on English that Algerians have requested from the embassy for years. So we did a series on the TOEFL. We did a series on business English that we just wrapped up. Our next series coming up will be about submitting materials for study abroad programs, like application materials. And this program that we're doing is all about medical English. So you can see that today we are focusing all about mental health. This is me. Hello. And this is the program. So we have done an introduction to medical terminology, communicating in the medical field, really looking at doctor-patient communication. We've talked about medical exams, especially like politeness phrases, how to ask for requests politely, how to reassure, how to provide guidance. Last week was all about prescriptions, medications, really focused on pharmacists, pharmacology. And today we're talking about mental health. After today, we only have 1 session left, and that last session will be really focused on research conferences, kind of more about presentation skills in English for those who are in the medical field and want to participate in international conferences. So this course is free. It is online. It's here on Zoom. We're recording, and we'll be posting this on the YouTube channel in the slide in front of you, American Institute-DZ. And the courses are every Sunday night, 6:30 to 8. So it's a series of 6, and this is number 5. The course rules are to stay appropriate, stay on topic, and please participate. So I see that we have a good number of folks with us here tonight. I hope that you will participate by writing your answers to different questions in the chat. This is the only way that I make sure that I hear your voices. I see your questions. I know if you're following with me. So even though we're in an online webinar, I like to treat this like my own classroom. So please, if you have any questions or when I ask you a question, please contribute by writing in the chat. For those who've been here before, you know these rules and you know how I really like to work with you throughout the class so you can help by answering some questions early on to show folks how it is done. So this is my disclaimer that I only have for the medical English program, but I always have to tell folks that I'm not a medical professional. I am a professional English teacher. So I provide you the terminology and the phrases that are relevant in a medical environment. But if you have a question for me about medicine or medical knowledge, it's very likely I won't have the answer. I think this happened in our first class where we were looking at medical equipment. And I know that the scanner is called a CT scanner. And someone said, what does CT mean? And I thought, I have never wondered, and I have no idea. So it does happen that you might have a question for me I don't know the answer to, but I'm hoping that there are some in this room who are interested in medical English because they're studying medicine. So I want to rely also on your expertise and your guidance. If there's something that I say incorrectly, feel free to jump in. And I will provide the guidance on the English side. We're going to start off with kind of an open question, just to get us oriented around this topic. We are talking today about mental health. I want you to tell me in the chat, it can be a word, it can be a phrase, it can be an emotion. What comes to mind when I say mental health? What do you kind of instantly think of? Please send me in the chat. Mental health awareness, mental health issues, awesome. Anxiety, cool. Not that anxiety is cool, but thank you. I think that for me also comes straight to mind when I think mental health. Send me more. Stress, great. What comes to mind when we hear the term mental health? Depression, trauma, Depression. When you send in the chat, you'll notice that you can choose to send your comment just to the hosts and panelists, which is myself, or you can send the comment to everyone. So just take a second to look at that little blue box in the chat. If you want others to see your answer, then you should send to everyone, and that will help us have a good discussion. You can also send it to me, but I usually read out loud anyways, so it might be easier. I encourage you to send to everybody. So we have trauma, depression, how to regulate emotions, mental health. It's about something health, current health. Okay. It is about your health, definitely. Oops. Before we go into what doctors are involved, I'll maybe share a little bit. For me, what comes to mind when I hear the term mental health? Okay, Aya says a mindset, Sarah says well-being. So yeah, I think for mental health, it's interesting because we're studying medical English. And when people think of a medical environment, we almost always the first thing we think about is physical health. We think about viruses, we think about broken bones, we think about car accidents, very sort of visceral. By visceral, I mean strong images of physical pain. And it's often the afterthought or the second thing, maybe even the third, fourth, fifth thing we think of when we think about health is thinking about mental health, the type of injuries that we do not see on the body, but that are happening in the brain. It also is a subject that is relatively new. I say relatively because it's not that new, but compared to, the numbers of medical journals dedicated to physical illnesses, I would say that mental health has only more recently begun to be respected as equally dangerous in some ways, or equally serious as physical health. So everything that you listed is, when you listed a few conditions, so I saw depression, I saw anxiety, but you also listed, I was happy to see, some things that are not disorders, but that are very closely connected to mental health. And that's when we're talking well-being, when we're talking about stress, when we're talking about worries. Everyone struggles, just as we all have little concerns with our physical health. We get cuts, we get bruises, maybe we get acne on our skin, or we get dry skin. And then, of course, more severe illnesses, we get colds, we get flus. So everyone deals with health problems when it comes to their physical health. And I would also say that everyone at some point in their life deals with health problems when it comes to their mental health, whether or not it's a disorder or just I'm having a low day, I'm really stressed right now, things like this. Now, before we move into really looking more closely at mental health, I want to first get on the same page about the medical professionals. These are things, these are terms that we use in English, and they mean something. So some doctors have different responsibilities than other doctors. I have on my slides a total of 6 doctors who are involved in mental health care, and I want to see if you can find all 6. Who are the 6 types of professionals that will be involved in mental health care? So I have psychologists, good. Psychiatrists, good. So Selma and Sydney are saying the same thing. Psychiatric for us is the adjective. So a psychiatric care or a psychiatric hospital. The doctor, the profession, is a psychiatrist. Good, so we have psychiatrist, we have psychologist. Think bigger than this. The question is not which doctors specialize only in mental health care. It's what are the doctors who get involved when there's a mental health problem. Neurologist, okay. I have a total of 6. A total of 6 doctors who are involved with mental health care. General practitioner, good. Thank you, Sydney. Yes, right? Because I didn't say that they only do mental health care, but that mental health care is something they are involved with. So a general practitioner, just a general doctor, they will often be the first doctor to deal with mental health problem, right? It's their regular patient. They see They come in, maybe they come in for a cough, and then they start talking about having a lot of depression. So that general practitioner is very closely involved in the mental health care of their patients. So marriage therapy, okay, marriage therapy is a type of care, but you're on the right track with the last word. Therapy is a type of care. What do we call the people who lead therapy sessions? There's actually two words for this profession. Therapist. Good. I think we're close to most of these, so I'm just going to show you the 6 professions. Yeah, therapist. Good. So psychiatrist. So psychiatrists are medical doctors who specialize in the diagnosis, treatment, and prevention of mental illnesses. They are trained in both psychological and medical aspects of mental health care and can prescribe medication. So a psychiatrist is a full medical doctor who's gone through a full medical education. So they do all their years in school, they do their what's called residency in the hospital, and they pick psychiatric care as their specialty. Because they are fully trained doctors, they have the ability to prescribe medications. So psychiatric is often considered the most, let's say, traditional of all of doctors, or not traditional, maybe, what's the word I want? Serious in some ways, that if you really are having a big problem and your mental health care is at a crisis point, that a psychiatrist is someone you would absolutely have to see. Next, we have psychologist, and I've already put it on the screen. Thank you, Sarah. Classic. Yeah, classic doctor. Maybe this is the word I'm looking for. So psychologist and psychiatrist, the most common question about these is, what is even the difference? So a psychologist, you still have someone who's gone through a lot of education. A lot of times you're going to have someone who has their PhD. So they've gone through undergraduate, master's, and doctoral studies, but they are not doctors in the sense of medical doctors. They have not gone to medical school, because when you go to medical school, you don't specialize in the beginning. So you become a fully trained, essentially a general doctor. And then at the end, you specialize. That's the psychiatrist. Psychologist essentially is someone who specializes from the beginning. They study the topic of psychology. They can start undergraduate, but they definitely study it at their master's, and they can study it as a doctoral degree. So they are not allowed or not legally able to prescribe medication. So when you go to counseling or therapy, you can be seeing a psychologist or a psychiatrist. And then on our sort of pyramid, if we go from like the most training, the most capacity, the most kind of classical doctor, that's the psychiatrist. Then we have the psychologist, a little bit less training, a little bit less permissions. Then we have counselors and therapists. So counselors and therapists is really a broad name. A lot of different programs can result in you becoming a counselor. It's something that is licensed differently. So different countries have different definitions, have different requirements. Some countries might require 3 years of training, others maybe only 2 years of training. So counselor or therapist is really the general name for professionals who are allowed to provide mental health counseling. So it's hard because the definition I'm giving you is almost circular. A mental health therapist is someone who's allowed to provide mental health counseling. The reason for that is because there's so many different rules. Someone who's a therapist in the United States, maybe it's required that they do 2 years of training, 1 year of practice. They're allowed to make some recommendations, but not others. They can do some types of therapy, but not others. And so it's something that really what you should keep in mind is that it's the lowest amount of training, the shortest amount of training, and a therapist has the least abilities, not least abilities, has, I guess, lowest level of permission. They certainly can't prescribe medication. Also, you can say that therapists work in not just in doing therapy. You can also find them, for example, working with nonprofits, doing something that we call social work. Social work is someone who maybe you're working in a school, maybe you're working in a homeless shelter for homeless people. Maybe you're working in a public housing for people who are living in government housing. They don't have enough resources to buy their own housing. A lot of these places will hire a counselor or a therapist to help the individuals receiving care. So they'll say, okay, this is a homeless shelter. We provide them with food, we give them a bed, but they also, sometimes people are homeless because they've suffered violence or they've suffered traumas. And so they hire a counselor to help work with that specific population. So counselors you can find in different types of roles and different types of specialties. And then we have PCP. So a primary care physician is another word as a general, as a synonym for a general practitioner. I would say primary care physician is American, general practitioner is more British, but keef, it's the same idea. So these are basically doctors who provide a very general level of care. If you have the flu, you go to your primary care doctor. If you have a toothache, you can go, I suppose they'll direct you to a dentist. If you're getting chronic headaches, you go to your primary care. If you need a vaccine, you go to your primary care. And then if you report certain issues, they connect you with other doctors. So they're the first doctor you see, who then when they hear your problems, it's called refer you. They can refer you to a specialist. And so as I gave my example earlier, when I saw Sydney's answer, sending the general practitioner, it's exactly what I said before, which is that these doctors are often the first ones to hear about an issue and refer you to a specialist. They can diagnose, so they can listen to what you're telling them and they can say, hey, that really sounds like depression, and they can make recommendations, but they're not necessarily in a position to prescribe medication because they are not a specialist. Even though they're a full doctor and they did full medical training, they will still be obliged to send you to a mental health specialist who is a psychiatrist to prescribe medications. Sydney, I see your question asking about a social assistant. Hussein's answer, it's a social service worker. Yeah, it's social service worker is going to be more appropriate. I'll put in the chat, this type of work is called social work, and we call them social workers. And when we say someone is a social worker, we understand that they're working with generally poor populations or people at a disadvantage, like immigrants, refugees, women who experienced abuse, children who ran away from home. So a social worker is someone who works with these disadvantaged populations. Put it in the chat because it's kind of a technical term, but this is how we say it when we're talking about, you know what it is actually. It's considered not appropriate to say poor people. Like the phrase is just super vague, kind of offensive. Not everyone who's suffering is poor, so it doesn't really make a lot of sense, or it's just not specific. So we've replaced that with these types of phrases, disadvantaged populations. But if you're looking at me like, hey, what does that mean in English? It is sort of a synonym or a replacement for just saying poor people or needy. In the past, we used to say the needy, and that's really fallen out of fashion. So nowadays we have disadvantaged populations. All right, back to our professionals, neurologists. So thank you to the person who sent neurologists. So really, a lot of times mental health disorders can be traced back to actual brain chemistry and chemicals and reactions. And so a neurologist can be involved in looking at certain mental health conditions. Usually they're not the typical ones you'd think about. So it's rare that someone suffering from depression sees a neurologist, but you might have something like, dementia or Alzheimer's, where you're noticing some depression or erratic behavior that can look like a mental illness, and a neurologist can help diagnose if it is in fact mental illness or physical illness that's affecting behavior because it's affecting the brain. The last one is about psychiatric nurses. So it says here nurse practitioner. It's just a fancy way of saying nurse. Okay, so you don't have to think, oh my gosh, what is the difference between a nurse practitioner and a nurse? It's a nurse. And so these are just nurses that are specialized in mental health care. Some of them actually have the authority to prescribe a medication. So this is a way of, especially in the United States or in places where you have not enough doctors. So I said the United States because doctors can be very expensive. There isn't a great national health system. So finding doctors, it might be too expensive. So a psychiatric nurse is a cheaper option. In other countries, it might not be about cost, but it may be about availability, where there's a 2-month or 3-month long wait list to see the doctor. And so having a psychiatric nurse who can prescribe medication can help make that process of getting medication much smoother. All right, so that was everything about the doctors. I would like to know, what are some key vocabulary words you associate with mental health? Just I already said throw me some words. You sent me some great words, but now we're actually going to go over some vocabulary, and I want to see if you already have some of what I'm trying to teach you. So do you have any key words? We had before well-being. Oh no. Yes, I think we had well-being. I'm ruining my own slide. We had well-being, we had stress, we had worries, we had anxiety, we had depression. We had mental health awareness. Okay. And any other key vocabulary that comes to mind? Trauma, we had trauma. Burnout, awesome. Disorders, great. Mental illness, depression, anxiety. I see nervosis, psychosis. I think maybe this is the technical word for it. Overwhelmed, dementia. Good. Anything else? The baby blues. I'm just going to correct you here now. We say baby blues like the color blue. OCD, bipolar. Great. Bipolarity, schizophrenia. Awesome. PTSD, good. I'm saying PTSD, great. Even though these are really serious disorders, but I'm happy to see that you already have some of this language. Paranoia, good. Addiction, okay. Great. I completely agree that addiction is a mental health disorder, so I'm happy to see that some other folks have that. Passive aggressive behavior, yeah, not everything's a disorder. Okay, some of these things are related to stress or related to insecurity or low confidence. Good. All right. So let me show you some words that I have. Toxicomania, I've never heard of that. Okay. I have 4 words. Some of them already came up, so I'm happy to see it. I want to see if you can help me with definitions. Just give me the definition that you think. I don't need the ChatGPT definition. I don't need the #1 on Google definition. In fact, that might be the definition I have in my slide already as I went to find good short definitions. I want your words. In your words only, what are we talking about when we say self-care? What is self-care? How do you define self-care? Toxicomania is about drug addiction. Okay. Self-care, taking care of your emotions and thoughts. Great. Hi, Samir. Welcome. Samir, you sent me your hello message just to me. If you want to send it to everyone, you need to change your little blue box to everyone. Who's seen self-care is the process of treating yourself in a good way. Being in harmony with your soul and your thoughts. Beautiful. How to stop worrying and start living. Nice. So the question is, what is self-care to you? How do you define self-care? Let me show you the definition I put up here, but this is the basic definition. This is not the correct definition. I wanted to see what you think about self-care. So broadly speaking, self-care is taking actions. Sorry, there should be an S, or taking action. Actually, I suppose you can do singular or plural. Taking action to preserve or improve one's own health. This is like the driest definition you could come across, which is why I started with your definitions. I think prioritizing your health is self-care, says Aya. I think that's a good one. I like how to stop worrying and start living. I liked the idea of being in harmony, treating yourself well. Great. Next up is burnout. What does burnout mean to you? What is burnout? Extreme fatigue and a careless state in both mind and body. Samir, I think you're sending self-care. Take care of yourself by doing sports, taking care of your teeth, your eyes by using glasses. I like that. All right, what about burnout? The drainage of one's body, oneself or body. Oof. I like that image, drainage, very severe. Saturation. Yeah, I think saturation in English, a better synonym is going to be overload or overwhelm. Yeah, professional depression, drained by reality, not fitting in. Interesting. All right, I'll give you my dry definition of burnout. Exhaustion caused by excessive and prolonged stress. Yes, but burnout, it looks different for each person because one person's burnout may look like I have to quit my job. I'm fully unable to function. Someone else's burnout could be that I'm no longer sleeping. I stop calling my family and friends. I stay in my work, but I kind of disappear from my own life. Another person's burnout could be I'm crying every day and I'm in giant passionate arguments and fights and it's an excess of emotion. So for everybody, that extreme exhaustion that can arrive due to stress, some version of stress that is long enduring, it's not going away and it slowly is eating away at your mental health, everyone's reaction will be different. Okay. Support system. Give me a definition. Give me your definition, because my definitions are the internet definitions. Okay. I want your definition. What is a support system to you? What is, you can also tell me who is your support system. I'll give you 1 minute. Okay, I see yoga. Interesting. I see program to support yourself. I don't know. Meditation. Okay, so it looks like maybe we have to get on the same page of what is a support system. Support system, I'm going to show my definition first, is actually not about strategies. So I see you're sending me like meditation, therapy. These are wonderful. But a support system is about people. Support system are people who provide an individual with practical or emotional support. So when you ask someone about their support system, you ask them who. It's not what is your support system, it's who. So if I come up to you, I say, who is part of your support system? A really common question can also be, do you have a good support system? But again, we're only talking about people here. So your answer can say, yes, I have some really good friends. I've known them for years. I can call them about anything. You might also say, actually, no, I moved to a new city. I don't have any support system here. When I'm having a bad day, when I feel like I just want to scream, I don't have anyone to talk to. I don't have a good support system. So yeah, I see now the answers coming in. Siblings, close friends, friends. Absolutely. That's your support system. So your counselor can be part of your support system, but when it's someone that is, professionally connected with you, it's not the same thing. Support system is really supposed to be about people that you have organic relationships with. They help your mental health, but they're not only in your life because of the mental health. Because of mental health concerns, I should say. Let's see the question. Can they be totally strangers, but they just went through the same thing, so they empathize with you? Sure. If it's someone that you call, so maybe they were strangers when you met or maybe when you had a deep connection, you didn't know each other well, or you hadn't known each other for long. But to be part of your support system, they have to stay in your life. They have to be people who are there day in, day out, over months, even over years. So, okay, maybe they were a stranger in the beginning and the connection happened quickly. But if they're in your support system, then necessarily they're not strangers, at least not anymore. Yeah, people in your, I mean, so I was asking a question, is this like in our daily life? Yeah, it's people that any day you can call them. It doesn't mean every day you do call them. You know, my mom is part of my support system. It means that if I'm having a really bad day, I can call her and I can say, like, Mom, I'm having a terrible day. Nothing's going right. I'm miserable. I feel bad about myself, etc. But I don't need to call her every day because every day I don't need support. I mean, I also don't need to call her only for support. I can call her to check in on her. I can call her to give her support. I can just call her to talk about something random in the family. But when I need support, she's part of my support system. She's someone I call. It's, yeah, it's not just one person, one time. Yeah, thank you, Fatiha, saying they're available when you look for them. They're available when you need them. That is your support system, a constant group of people who you can contact. Yeah, like your secure base. That's a good one. It's like a secure base. Good. Let's move to well-being. What is your definition of well-being? State of harmony and balance from within. Again, with the word harmony, Hussein. I love that. Harmony and balance from within. Living in prosperity, everything available to you, food and things like this. So I don't know if well-being is about prosperity in terms of material wealth, but it could be having everything that you need. Being a positive person, being content, inner peace, good sensation, a combination of good physical, emotional, and mental health. I like that, thinking about everything. Peace of mind, state of happiness, health, comfort, being present and connected to yourself. Beautiful. So again, mine is my most basic definition, right? And in the most basic way, well-being is a state of being comfortable, healthy, or happy. Okay. But I like especially the ones that look at the different areas in which you need to have things generally going well in order to feel well, in order to feel content. So the physical side, the emotional side, and the mental side. All right. I have another question for you. Why is mental health important? Why do you think mental health is important? Why do we care about it? Besides the obvious, which is that when we are sick, we want to get healthy. Okay, great. But why do we put special importance on mental health? What do you think? What are some reasons why we care about mental health? And maybe you're telling me I don't put a special importance on mental health. But if you are someone who does, tell me why. If you don't yourself do it, imagine me. Imagine Ariella. Why does Ariella put special importance on mental health? So Ahlam says, because it's related with your physical health. Definitely, they are connected. They are, I won't say one and the same. They're not exactly the same thing, but they are very connected. Because it's what defines our mood. Let's follow it up with our actions. It's like our engine, because it's the core force that helps you keep moving forward in difficult times. Mental health and having a goal in life is literally what makes us alive. Wow, beautiful. Darkness is harmful for your soul because when you're morally disturbed, it leads to frustration and depression. Yeah, there's real risks, essentially. There's real risks associated with not caring for your mental health. So that is a little bit what I'm going to talk about in these next slides. But the message here is that not caring for it really comes with consequences. Really comes with consequences. Also, I want you to see that mental health problems are really widespread. So we care about them because they're really, really, really common. So my question now this is a little bit more of a quiz, but it's about the main question about the importance of mental health. So the first one is, what percentage of adolescents will report having a mental health disorder? Just guess. I'm not expecting you to know. Guess what percentage. I will have to tell you though that this is about American adolescents, because of course, anytime that we use statistics, we're talking about, we have to know where the number came from. So the number in this study came from the US, although I personally feel like it's probably not that different in a lot of countries, maybe places where they're living really differently, like the tribes of Brazil. I don't know if they would report, but those who are kind of living in today's modern technological world, I think the numbers are probably similar. So what percentage do you think? What percentage of adolescents will report having a mental health disorder? I have 99%, 35, 65, 40. Anyone else want to guess? 70. We're going to see who got it closest. 85. All right, let's try and see. The answer is just shy of 50%. And one thing you have to think about with mental health disorders is the fact that we are forced to rely on patients to report their own symptoms. A lot of times people are depressed, but they do a very good job of masking it. So they appear fine, they keep their same habits, they laugh, they smile, they go out with friends, and they try to deal with their feelings of sadness and despair and emptiness very quietly. So I would guess that most of these numbers are very low. So it is reported that almost 50% of teenagers, of adolescents, have mental health disorders. So I think I imagine it's even more. But basically, my question was, why is it important? And one of the answers is because 50% of our kids will have to struggle with a mental health disorder. So it's important to know about them and to know the signs and know how to deal with them. Similar to that, I think I have 3 or 4 questions total. What percentage of people are affected by mental health disorders at least once in their lives? So we've moved away from teenagers and we're looking now at adults. Of course, it does stand to reason that if adolescents are 50%, that everyone goes through adolescence, but humor me here, the statistics are different. This is a statistic worldwide based from the United Nations. And perhaps by looking at adults versus teenagers, we get some different numbers. Hi, Mohammed, welcome. Okay, so I see 40%, 70, 66, or 60. For some reason, I thought 60. So folks are generally guessing more than the teenagers, except for the 40%. 99. I mean, you can make a case that most of us have some kind of mental health disorder, but what I would caution you to consider carefully the line between mental health difficulty or struggle and disorder. Disorder is fully diagnosed. Symptoms match the sort of medical, I was going to say medical dictionary, medical reference book, versus what is much more common, which is stress, fatigue, burnout. These are not considered disorders. These are considered struggles, similar to, if you have sort of something that's bothering you and itching you versus a full-blown allergic reaction. So there's a scale, there's a level here. So actually, I'll show you the answer. The World Health Organization actually has the number at 25%. So 25% of people in the world will suffer a mental health disorder. I know the numbers from the teenagers and the numbers from the adults do not match up, but data in general is not perfect. And so I wanted to show you 2 different sources that the National Institute of Mental Health in the US now, because teenagers are only getting assessed now, right? This was not a study that was taking place in the year 2000 or the year 1990. So it's also true that maybe these numbers are going up and the data is not quite catching up to it. But we know generally between a quarter to a half of people in the world will face some kind of mental health disorder. Next question, and I think it's my last one in the quiz. What percentage of people with mental health conditions receive adequate treatment? Conditions is kind of a broad term because it involves individuals with diagnosed disorders, as well as some who are struggling but maybe don't have a disorder, but they still want medication. So what percentage are getting good treatment? Okay, we have 50%, 60%, 30%, 25%. Any more guesses? 65%? Okay, let's look at the answer. So you have to bear with me. The answer is in the reverse. So the question was, what percentage get good treatment? The answer I have is that actually between 76 to 85 of people with severe mental disorders in low and middle income countries receive no treatment. So that would mean in a low or middle income country, which if you look at sort of the United Nations website, you can see which countries they're including, but it's the vast majority of the countries in the world. You only have, at a maximum, you have 24% of people receiving treatment. Maximum number is 24%. These are people who have diagnosed disorders, struggling with schizophrenia, struggling with bipolar disorder, struggling with PTSD. Only 1 out of every 4 is actually getting any kind of treatment, medication or therapy. So this also comes back to my question about why is it so important to focus on mental health, because it's going really, really underdiagnosed. We have another number for high income countries. So high income countries, you're really looking at Europe, you're looking at Canada, the US, Australia. Even in a high income country, you will have up to 50% of people with disorders going untreated, 35 to 50%. So it's not obvious. It's not obvious if you have a mental health disorder, if you'll get a diagnosis, and if you'll be able to access treatment. This is a quote that I found that I really liked, which is saying the #1 root of all illness, as we know, is stress. So this comes on my third reason. So at the beginning of the quiz, I said, why should we care so much about mental health? So my the messages I'm hoping to convey, #1, we should care so much because it is so common. So many people struggle. #2, we should care so much because treatment is so far really limited. So we have a big disparity between the percentage of people experiencing mental illness and the percentage who can actually get treatment for it. And then #3 is that physical and mental health are connected, which is something that you all put in the chat from the very beginning. And I was really happy to see that, which is that there is a direct connection between our mental states and our physical state. This quote is saying that when we feel stressed, we get sick, which for me is absolutely true. When I feel stressed, my immune system is low and I am always more likely to get sick. All right, thank you. Next question. What are some signs? What are some signs from someone? You're looking at your friends, you're looking at your family members. What does it look like when someone's struggling with mental health? Knowing, of course, that sometimes there are no signs. There are some people who never reveal or never make it obvious that they're struggling with mental health. But sometimes it's noticeable. Send me in the chat, what do you notice when you see someone and you think, I think maybe they're struggling. I think maybe they have a social anxiety. Maybe they have obsessive compulsive disorder. Like, what are some signs that someone's mental health is going down? I see isolation, low productivity, loneliness, no talking, no social interactions, zoning out, mood swings. Disturbed ideas, disturbed ideas. How would we say this more fluently? I think disturbing ideas. Yeah, zoning out mostly. I think I said that one as well. Okay, great. We can put the changes that we see into, I think I have 5 categories. So the first one, the one you're speaking about mostly here, is about behavior change. So someone who's very social begins to isolate themselves. Someone who loves doing, let's say, karate or taekwondo or some kind of martial arts suddenly has zero interest and completely stops doing it. So we have to be careful because there are individuals who are simply not very social and who like to be isolated, in which case it's not a change in behavior that they're isolated. But if you see someone who used to be very social and to go out and meet friends, suddenly there's a change, that is something to pay attention to. The next one is actually about the concentration. When you are dealing with mental illness, your ability to focus, especially on complicated tasks, on complex questions, on decision making, when someone's asking you to choose between 2 things, when you're suffering from a mental illness, you'll find that your brain's ability to make decisions and to concentrate is actually really reduced. So you'll have difficulty focusing, you'll become more forgetful, you might have what's called decision paralysis, which is when someone asks you to make a decision and you completely freeze. Like, I have no idea what decision to make. I can't even think. That's decision paralysis. Okay, so we have behavioral problems, we have behavioral changes, concentration problems. Interestingly enough, when we're looking for symptoms of a mental health problem, we can sometimes find physical problems. The example I gave earlier is about someone who has a cold. You can find people who have colds, flus, these kinds of illnesses repeatedly, which shows you they're working too hard, they're not sleeping enough, their immune system is down. Okay, so that can be a symptom of stress or of burnout. You also can have people who start to get frequent issues like headaches or stomach aches, and there's no obvious cause. So these pains, these aches end up becoming unexplained and unexplainable. I know many individuals who went through endoscopy, which is where they put a camera down your throat, as well as a colonoscopy, where they do the same but up your colon, because they had really bad stomach issues. And none of the doctors could figure out what was going on. Eventually, they switched jobs, or they dropped out of their master's program. They did something to reduce the stress in their lives, and these physical symptoms completely disappeared. So sometimes unexplained physical pain of some kind can also be a signal that there's a mental health issue going on. And then we have emotional instability. So especially when we're looking at mood disorders, anything that's excessive and doesn't match the situation can be a signal of a mental health concern. So excessive worry, excessive fear, excessive sadness, especially if these emotions begin to interfere with your ability to live your life. I'm too worried to leave my house. I'm too scared to leave my house. I'm too sad to leave my house. I don't know. There's probably other examples. I'm just sticking with leave my house. Because sometimes when you are in the middle of a mental illness related to mood, it can be what keeps you from going out into the world. We can also have rapid mood changes. So people who are sobbing, crying, and then laughing and back and forth throughout the day, often unexplained. It's not obvious why these changes are happening. All right, so let's just go over these again. We had 5. Oh no, we had 4. Some of the signs that someone might be struggling with mental health. So change in behavior, concentration problems, unexplained physical pain, and emotional instability. Aya is asking, isn't concentration aren't concentration problems coming mostly from the fast dopamine we get from social media and the impact on our focus? It's not always a mental health disorder. Yes, it is definitely not. Please remember, these are, let's see the question. These are some signs that someone might be struggling. So all of these things that we mentioned, change in behavior, concentration problem, unexplained pain, emotional instability, these are symptoms that may have their explanation in mental health, but they don't necessarily have it. So when you see concentration problems, there could be something else going on. When you see emotional instability, maybe it is actually explained. It's not unexplained. You just don't know that that person is going through a breakup, for example. Changes in behavior, when our children get older, sometimes they change. They used to be introverted, now they're more extroverted, and vice versa. So please don't take this list as symptoms that definitely mean you have mental health concerns. They are simply things that can be a signal. And if you are a witness, so if you witness this in a friend, it's a good sign that maybe you should look a little bit deeper and ask questions. Thank you, Aya. Oh, oops. All right. This one, I have a whole list, but I want you to help me generate a list as well. How do you, I'm pointing on the screen to all of you listening on the other sides from your homes or your offices or your cars. How do you take care of your mental health? What do you do to reduce your stress, to relax, to calm down? What are some strategies? There was one earlier that I didn't say because I knew this slide was coming up. I forget who said it. It's Mohammed Amin. The first thing to do to avoid stress is to drink plenty of water. Love it. What other strategies do you use? Physical exercise, communication, practicing hobbies, positive self-talk. I like that. Positive self-talk. Very sweet. Anything else? What about going on walks, going into nature, meditation? Nice. Working out, definitely. For me, I would put on my list hugging my dog because I have my dog who usually interrupts our courses, but today I have locked her out. So we have tranquility and peace. But when I have a bad day, hugging my dog really makes me feel better. Eating comfort food, totally. Eating comfort food. Watching the Joker movie. Wow, really? That makes you feel better? That's a scary movie. Or disturbing movie, I suppose. Doing hobbies, music, painting. Those sound also like very peaceful, soothing hobbies. Taking up new hobbies. Nice. Keeping your brain active, learning something new. Cool. Hanging out with friends. Good. I was waiting for someone to mention this. Yeah, it's really common that when we have a bad day or when things don't go our way, we want to connect. I want to vent. I want to be distracted. I want to laugh. I want to feel alive. I want to forget my troubles. Yeah, no better way to do that than with our support system, friends or people that we love. Great. All right, I'll show you the list I composed and we'll see if everything is on it. Regular exercise. Great. Definitely having regular exercise. Healthy diet. So, of course, eating comfort food can help us in the moment. In the long term, eating healthy is going to help reduce stress. And maybe comfort food is healthy. And I don't know what your comfort food is. My comfort food is not healthy. I would say my comfort food is basically pastries. I just want to eat pastries all day long, but also fruits, pastries and fruit, but nothing with like protein or good nutrition. So in the long term, to reduce stress, we are going to need a healthy, balanced diet. Adequate sleep, which as we now know, if you've been seeing the same news come out as me, that women actually need more sleep than men. So understanding how much sleep we need and then committing to it. Building strong relationships. Yeah, having that support system. Communication, talking to individuals around you when you're having a hard time, sharing your problems, listening to others. Managing your stress, which I realize looks a little silly because aren't all of these things about managing your stress? But this one is a little more explicit, like actually creating tools and techniques to manage when you have stress in your body. So whether it's, taking soothing breaths or taking a break from work or trying to delegate tasks to other people on your team at work, but actually deploying some direct stress management techniques. So not long-term, okay, I'm going to exercise and eat well, but in the moment of stress, what do I do to reduce it? So I was saying, but how can you manage your stress really? So for me, I think some of my strategies are mental exercises. So reminding myself what really matters in life, what are the most important things, and it's usually not what I'm stressing about. Trying to think about gratitude, 3 things I'm grateful for that day. So these I would call stress management techniques because it's in the moment of stress, ways that your brain can switch out. Time management, so making sure that you are not filling your life so full that you're creating your own stress. Managing your time so that you're not always behind on work, behind on deadlines, because that will also create a lot of stress. So essentially planning your life in a way in which you can have positive and good mental health. Engage in activities you enjoy and having creative outlets. So these can be the same if you're naturally a creative person. Maybe the activities you enjoy are creative. So we had some examples of painting and I think, was it musical instruments? It was maybe dancing. There was another creative one that we just had. But for those who say, no, activities I enjoy are not creative, there really is a stress reduction benefit for everybody related to creativity, whether it's singing in the shower or doing a TikTok dance or doing a little doodle, small drawing, that our bodies tend to relax and we are removed from the stress of our daily lives when we engage in something creative. Great. Oh, okay, I have to go back because this is the game and I like to see how fast you can get it. So before I change slides, we have the vocabulary game. So if you're a regular attendee, you've played this before. If you're new, I'll explain how it works. I have 4 words. These are vocabulary words related to the theme, and I have 4 definitions. Okay, the words have numbers. We have number 1, 2, 3, 4. The definitions have letters, A, B, C, D. I want you to match the word with the definition. So let's say the word 1, you can say 1 matches with the definition of C. So the answer is 1C. 2A or 2B. I don't think I'm giving it away because I don't remember the order I put them in, and I'd like to see how fast you can get them. So on your marks, get set. Oh, and you need to send them in the chat to get the credit. Go. All right, answers are starting to come in. I'm not going to read them out loud because I don't want to give them away. You can send them one at a time, but you have to send all 4 to be crowned the fastest one. So you can send them separately, but I still need all 4, or you can send them all together. I'm still waiting for my winners. Okay, we might have a winner here. He sent it just to the host, so others can't see. Let me just check your answers, Mohammed. Okay, hold on. Yep, so Mohammed wins. Congratulations. I just checked. They're all right. I'm not going to read them out because we're going to do it together. Mohammed Sibawen. Congratulations. To the others still playing. Yep, I see most of you getting them right. I'm going to go through them one by one, though, and please tell me what is the right letter. So we start with resilience. Number 1, what is the right letter for resilience? Resilience is number 1, and it goes with what letter? B. Thank you. Resilience is the ability to recover quickly from difficulties. And what is the adjective of resilience? What do we call a person with resilience? I want the adjective form, please. Resilient. Thank you. A resilient person. Oh man, my dad had such a tough life, but he is a resilient guy, and he fought his way up and went to university and this and this and this. Resilient. Number 2, therapy. What is the letter with number 2, therapy? C. Thank you. Therapy is treatment to relieve or heal mental or emotional problems. Good. I thought that would be the easiest one because I knew at this point we would have already talked about therapy. Number 3, stigma. Stigma. I'm curious if you had heard of stigma before. Stigma is A, exactly. So stigma is a mark of disgrace or social disapproval associated with a circumstance or a condition. So it's important that you see when we say disgrace or social disapproval, we're really talking about people's opinions. They're treating you in a negative way because of something that either an illness that you have or something they associate with you. And so we can say there's a stigma around certain conditions. When we're in the mental health world, you can say there's a stigma around schizophrenia. People think schizophrenic people are dangerous, violent, don't want to be near them. And okay, maybe there are some schizophrenic people who have been violent, but someone who's on medication, you know, they don't want to be treated like they're going to be violent at every moment. So you could call that a stigma. Could I put the word in a sentence to understand it better? Sure. So I have my schizophrenia example, but let me think of another example. Well, I have an example later. I don't want to ruin it. So I'm trying to come up with one that doesn't use it. You can say there's a stigma with, no, that's my example later. With bipolar disorder. So someone who's bipolar means that they get really manic and happy and then really depressed. And that if someone applies for a job and they write on their job application that they have bipolar disorder, maybe they wouldn't get hired. The hiring manager will say, I don't want someone with bipolar disorder working here. I don't know if I can trust them. So that's an example of a stigma. It's like saying a bias, a negative bias. Except instead of saying the hiring manager has a stigma, we would talk about a stigma related to the disorder. There is a stigma around bipolar disorder. It can be hard to get hired because of this. It can be hard for people with bipolar disorder to get hired because of the stigma. So here's 2 sentences that you can use as examples. There is a stigma around bipolar disorder, just as a simple sentence. Another one is, it can be hard for people with bipolar disorder to get hired because of the stigma. Good. So that means number 4 is the only one left. What letter? I know it's obvious, but I'm still wanting to see that you're with me. What letter? D, thank you. So mindfulness is being fully present and aware of the current moment. And mindfulness is often, these days, shared as a technique for helping with mental health. Thank you, everybody. And good job, Mohammed. So this is, oops. Oh no, I gave it away. I hope you didn't see the slide. This is my next game. We have 2 more games before we finish, and they're all vocabulary learning games. I'm hoping to teach some vocabulary around mental illness. I want you to read the example and tell me, what is this an example that is describing? It's describing a vocabulary word that we learned today. So the example is, an employee tells their manager that they're experiencing anxiety and need some time off to seek therapy. The manager responds by saying, can't you just tough it out? Everyone gets stressed sometimes. Taking time off for this is a bit excessive. Basically saying, no, I'm not going to give you time off for therapy. Everyone gets stressed. Why do you need time off? What is this an example of? If you can think of a word that we learned tonight, the negative reaction of the manager is an example of, good, stigma. It's a negative stigma around having a mental health disorder. The manager doesn't really think it's important. He disapproves of the request. He's very judgmental. He sort of minimizes it, like, oh, really? You think you have a problem? Come on, everyone gets stressed. It's this negative opinion around experiencing any kind of mental health disorder, and a disapproval. Thank you, Sydney, a disapproval. Good. What is this an example of? Again, I'm looking for a vocabulary word that we have gone over in today's lesson. So here is the scenario. Someone has struggled with depression for years, experiencing periods of deep sadness and hopelessness. Despite these challenges, they consistently seek out therapy, practice self-care routines like exercise and meditation, and actively engage in supportive relationships. Over time, they develop coping strategies that help them manage their symptoms effectively, allowing them to maintain their job and personal relationships. It's an example of, let me check the chat, resilience. Very good. It's someone who's really struggled and maybe is still struggling, but pushes to rise above and does see some success from their efforts. Great. Next, what is this an example of? And it's a word we've studied tonight. Emily, a dedicated nurse, begins feeling emotionally drained and physically exhausted due to the demands of her job. She finds herself becoming increasingly irritable with colleagues and less engaged with patients. Her sleep patterns become disrupted, and she experiences frequent headaches and muscle tension. What is this describing? Burnout. Exactly. This is classic burnout. It's overtime, a lot of stress, a demanding job. The exhaustion builds and builds and builds and builds, and she starts getting physically sick and really not able to handle the challenges of her life as she normally could. Next, what is this an example of? Ahmed, a young professional navigating the demands of a high-pressure job and adjusting to life in a new city, finds support in his weekly basketball games with a group of colleagues. They often grab dinner afterward, where Ahmed feels comfortable opening up about his challenges at work and his homesickness. What is this an example of? It's a word we studied today. Very good. This is an example of a support system. Someone who is struggling, who's having a hard time, but has a community that he can go to where he can talk about his challenges and what he is struggling with. I think we have one more. Yep, this is our last one. What is this an example of? James, whose mother is undergoing treatment for serious illness, finds himself overwhelmed by caregiving responsibilities and emotional strain. Recognizing the need to support himself while caring for his mother, James arranges for respite care. Respite care is when you ask another caretaker to come for 1 hour, 2 hours to give you a break. So James arranges for respite care periodically to take short breaks, during which he goes for walks in the park or meets a friend for coffee. Oh, I showed the answer. Damn, shoot. What is this an example of? Although Sarah, I think you got it before. Well, I already showed the example. Sorry, everyone. This is self-care. So in the middle of having a really difficult, the middle of a really difficult situation, James is able to find ways to care for himself. All right, the last thing we're going to do today before we close, and thank you for playing all my games with me, and I hope you're learning some new vocabulary around mental health. This one is called Name the Mental Health Disorder. So this is a mood disorder characterized by persistent feelings of sadness, loss of interest or pleasure in activities once enjoyed, and a range of other physical and emotional symptoms. Name the disorder. Good. Well, not good. I have to be careful saying good because these are really tough disorders. This is depression. We are describing depression. I know people are laughing. Yeah, not good. All of these are not good. Just like when we do any of our physical health slides, when we talk about high blood pressure, you get the answer. I go, yes, exactly, high blood pressure. Okay, depression is all about feelings of sadness and loss of interest in things that you once loved. Name the disorder. This is a group of mental health disorders characterized by excessive worry, fear, or apprehension. Apprehension meaning nervousness, scared to move forward, not sure. Anxiety, very good. So when they say a group of mental health disorders, essentially we're looking at things like panic disorder, as well as social anxiety disorder. There's a lot of specific types of anxiety disorder that you can have. Next, name the disorder. This is, oh no, shoot, I showed my answer. Well, I'll read it anyways. This is a mood disorder marked by extreme shifts in mood, energy, and activity levels. It typically involves episodes of mania, which is when your mood is really high or super happy or super pumped and you have tons of energy. In fact, in these periods, maybe people with bipolar disorder stop sleeping. That's how much energy they have. But then they will crash and experience depression. So since I showed it to you already, we'll just go to the next one. But this is called bipolar disorder. And bipolar is a way of saying bi, meaning two, polar, meaning opposites, from high to low, from high to low. Okay, I'm going to be very careful on my slides so I don't give them away. Okay, I'm not touching it. This is a chronic mental disorder characterized by disturbances in thinking, emotions, and behavior. Symptoms can include hallucinations, delusions, disorganized thinking, and really a reduced ability to function socially. Name the disorder. Yeah, you guys got it. Schizophrenia. This is describing schizophrenia, chronic mental disorder, meaning that once you have it, you always have it. Compared to depression and anxiety, where you can have it and then it will go away. Okay? But schizophrenia is a diagnosis that it means that you always, schizophrenia and bipolar are both chronic. It means it's something you always struggle with. So I is asking, is this a temporary disorder? No. Schizophrenia is a condition that you will have your whole life. Usually individuals start showing symptoms in late teenage years. And it's very disturbing. You hallucinate, you see people who are not there. You can have very paranoid thinking. You can hear voices. A lot of schizophrenic people start to feel like there's conspiracies. There's someone after me. There's someone who wants to kill me. They enter into really an alternate reality. Luckily, there's medication. So schizophrenic individuals can receive medication that will help break the disorder. But it is chronic, so you will need to take that medication your whole life. Something that can be very sad about schizophrenic and bipolar disorder is they can be so disruptive in your life that you maybe can't keep a job. And so especially in the United States, where we have a big problem with homeless people, we have, well, I shouldn't say a problem with homeless people. We have a homelessness problem, meaning there's a lot of people who don't have housing. And a big percentage of them don't have housing because they struggle with schizophrenia or bipolar disorder. So they can't maintain a job. They're not able to have regular income, and then they lose their housing, and it's a vicious cycle. All right, next. Name the disorder. This is a mental health disorder characterized with persistent, unwanted thoughts or obsessions and repetitive behaviors or rituals. We call these compulsions, performed to alleviate anxiety or distress. All right, I see the answer is already coming in. It is correct. This is called obsessive compulsive disorder, or OCD, meaning that someone suffering from OCD will have in a fixation, an obsession over something, and behaviors or rituals will help relieve the obsession. So I had a friend who suffered from OCD, and every time she turned the light switch on, she'd have to turn it off and on 4 times. It was a little ritual, and it had no inherent value except for her. It made her feel better. So you see a lot of these, what we call obsessive behaviors in individuals who suffer from OCD. Good. Next, this is a mental health condition triggered by experiencing or witnessing a traumatic event. Symptoms may include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. Good, the answers are correct. PTSD. PTSD stands for post-traumatic stress disorder. And these are, this is a symptom that it can be chronic, can be something that you suffer with your whole life, or it can be something that just happens for a period of time after a trauma. So an individual who is in a car crash may have severe anxiety and stress and unable to enter a car. That would be a symptom of PTSD, someone who's unable to enter the car because they're remembering their accident. Okay. Next, this is a neurodevelopmental disorder, meaning about the brain, characterized by difficulty maintaining attention, by hyperactivity, and by impulsivity, being impulsive, that interferes with daily functioning and development. This one has become much more common since COVID and TikTok. It's very popular in the TikTok world that people make videos about this. The answers are correct. This is ADHD. Before I show you the full answer, I want to challenge you. Can you tell me, what do the letters mean? Who can send me the full name of ADHD? What does it mean, ADHD? Maybe you don't know, but maybe someone out there knows. I don't know if you're Googling really fast, what is ADHD? But Noelle has one of the words right. She wrote hyperactivity, although the word in the acronym is actually hyperactive. We have attention. Yeah. Okay. Lydia got us the full one. Attention. I'll put it on the screen. Attention deficit / hyperactivity disorder. So attention deficit, meaning someone doesn't have the normal attention span, whereas one person could listen to a teacher for 10 minutes, another person after 2 minutes, they have lost their attention, they're doing something else, they're on their phone, they're tapping their fingers, they're making noise. That is the attention deficit. And the hyperactivity is all the movement. So actually, I should say attention deficit doesn't mean that you're moving. It just means that whatever you were focusing on has lost your attention. So sometimes attention deficit can just be staring into space. The hyperactivity part means that you're not staring into space. You're actually, when your focus is lost, your attention is lost, you move a lot. You're active. You're looking for things to stimulate you. Absolutely. So I believe we're coming right to the very end of my slide. This is my last question. Let me just check. Yeah. I don't think we have time to talk about hesitation, so I'm just going to ask quickly, what are some mental health disorders that you know of that I did not include? Because I only included the top 8 most common. Do you have any other mental health disorders that I did not mention? Lydia's mentioning autism. So that's really interesting, Lydia. I've never thought of autism as a mental health disorder. For me, autism is a developmental disorder. That has a lot to do with brain chemistry. So I personally would not consider it mental health. I would consider it developmental, but it's a good question. TOC, what is TOC? I'm not familiar with this acronym. Paranoia, yeah, I think paranoia could be something, I don't know if you can have it as a disorder. Paranoia is usually a symptom. TOC is OCD in French. Okay, so we have OCD. Hypochondriac, a hypochondriac. I wonder if that would be considered part of OCD. Aya is asking, is overthinking a mental health disorder? So some people have started characterizing it as such, saying overthinking disorder. I'm a little stricter than that. I think that overthinking is a symptom, not necessarily a disorder. But again, it's not up to me. I don't make these decisions, and really eventually it might enter into the official status. Who's seen eating disorders? Yeah, eating disorders, definitely. I didn't get a chance to include them, but eating disorders, including anorexia, which is people who don't eat, bulimia, which is people who vomit everything they eat, and there's a few others as well. Raji is saying paranoia is a disorder. Okay, I trust you. If there is paranoia disorder, it's not just a symptom, then I trust you. Sydney's giving the French words for OCD. Narcissism. Yeah, I get this a lot. Is narcissism itself a disorder? Is it a symptom? You know, some people will talk about psychopathic disorder or psychopathy, and that narcissism is a symptom of this. But there's a lot of different, there's a lot of dialogue around what gets classified as an official disorder, what is a symptom of a disorder, different people really making arguments about why some should be considered this and that. And it matters how we categorize them, because it will affect your ability to get medication. It can affect the stigma. It can help reduce stigma. So thank you. Thank you very much, everyone. I think we'll wrap it up there. I had one final question we don't have time for, but it's about stigma, saying what are some reasons people might hesitate to seek help for mental health issues? You don't have time to go through all the answers, but I'll share my answers, which is essentially shame. A lot of people feel shame and embarrassment, even humiliation or guilt around symptoms, even though the more we learn about mental health disorders, the more we realize that a lot of these are genetic and they're not actually linked to, personality as much as they are circumstance or genetics. But shame is a big reason, feeling judged, the stigma around mental health. So this is what I wanted to end on, but we're already pushing up on 8 o'clock now. But I hope the course tonight was interesting for you. I hope you learned some new vocabulary. I hope you felt like you learned maybe something new about mental health as well. I always enjoy these classes. I enjoy our conversations. Our last class is super different. So it's not at all about mental health. It's not about a specific area of medicine. It's actually about research. The medical field, or people looking for medical English, one of the most common reasons you'll need it is to participate in conferences. So next week is all going to be about tips and tricks for presentations, or essentially presentation skills in English. Thank you very much, everyone. See you for our last medical English class next Sunday. I will stop the share and I will close up the class. Thanks for participating, everybody. Have a good night.